Hello and welcome to another episode of Let's Talk Health. Today's session will be on spine surgery, and to discuss this, we have with us Dr. Amresh, consultant neurosurgeon, Citizens Hospital Sharing Company, Hyderabad. Good evening, doctor.
Good evening.
So, before we start with the question, can you give our viewers a glimpse on your expertise, please?
Hi, I'm Dr. Amresh. I'm a consultant neurosurgeon here at Citizens Hospital, and I have an experience of more than 8 years. And today we'll be talking about some of the basic misconceptions of spine surgery. So, to start with, the spine surgery is usually done for the problems of the spine. So, the major problems of spine are the neck pain and back pain. So, one of the leading causes of loss of work is back pain. About 80 to 90% of the population will have some kind of back pain in their life, but only about 1 to 5% of those will actually have some kind of serious issue which will need some attention by a spine surgeon. Okay, so talk about spine surgery, anybody will be terrified when they hear that they will require a spine surgery. It's because there are a lot of myths and the facts are twisted when it comes to spine surgery. Spine surgery is one of the most common procedures done, and it is usually a safe procedure. Spine surgery is done because of the spine problems, and to understand the spine problems, we need to know that the spine is made up of bones, ligaments, intervertebral discs, muscles, and nerves. So the back pain can arise from any of these problems. But among the patients who come with back pain, most of the patients who come with a back pain, usually have either a muscle spasm or a mild type of disc problem. But there are a lot of misconceptions regarding spine surgery, and so that's what we're going to talk about today.
So, coming to the questions, doctor, my first question would be like, there's a belief that the spine surgery requires several days in the hospital and a long recovery time.
That's a common misconception among the patients. That's because of the old history of doing the extensive surgeries. But since the recent advances of technology, nowadays the surgery has been with very less scar, and so the hospital stay also reduces, maybe hardly 1 or 2 days.
Okay.
And it also depends on what type of surgery the patient is undergoing.
So coming to my next question, doctor, one more belief is that spine surgery is dangerous and I don't know if it will really work.
That's an absolute false assumption. And because spine surgeries are absolutely safe, that's because the detailed evaluation before the surgery, the planning, will give a good result and good outcome to the patient. So spine surgeries as such are not dangerous. It is as safe as undergoing a thyroid surgery or a hernia surgery.
Okay. Coming to my third question, doctor, do the patient need to go one more surgery once they are done with the first surgery?
That's another false belief. Most of the patients will not require another surgery because their surgery has been a very planned surgery, and once the disease has been tackled, they usually not require another surgery, and if they have properly followed the post-operative instructions and rehabilitation process.
So coming to my next question, doctor, there's a perception in the population that they don't want to see a neurosurgeon because the doctor just wants to do a surgery.
That's one of the common beliefs people have. That's absolutely wrong because we tend to be more in favor of conservative approach. We will be thinking of ways not to operate rather than ways to find surgery. So the treatment begins with at least 4 to 6 weeks of painkillers, rehabilitation, and physical therapy. If these things doesn't work, then the next option given will be injection therapy. If it still doesn't work, then the surgery is offered as a last resort. But there are certain situations where patient will be advised for an upfront surgery. So they have to be mindful of certain red flags, what we call, to identify the certain symptoms, which will help in us deciding whether the patient will require an upfront surgery or should we wait for some time. So red flags like the patient has a severe back pain with associated urinary problems. That means he's not able to pass urine, he's not able to pass motion, and he has weakness in his legs and there is no sensation around his saddle area. So these are the bunch of symptoms which come when the what we call it as a quad equina syndrome. So it becomes a emergency surgery. And then there are certain situations where patient will have back pain with severe fever. So we have to suspect a chance of infection. And there are situations where patient will also have unexpected weight loss and history of any cancer in other part of the body. So we have to suspect a possibility of a tumor. So when these red flags are there, imaging study like CT, X-ray or MRI will be advised immediately. Otherwise, we tend to normally wait for 4 to 6 weeks before we do an imaging. So once we do an imaging, we'll know what exactly the pathology is. So and then we accordingly will suggest for surgery.
Okay. So my next question is, doctor, is it necessary for a patient to go for other surgery if they have hardware like screws and rods?
No, that's not required, because the body will try to heal itself around the screws and rods. So there's no need to remove the screws and rods. In fact, they are actually necessary to maintain the stability of the spine.
Okay. So is it safe to do an MRI if they have a screws and rod?
Yes, absolutely. Screws and rods nowadays are designed which are MRI compatible, and they'll not be having any issues while doing MRI. And there are a lot of advances in the MRI technology also. The MRI sequence is also built in that way that there are hardly any artifacts nowadays with the screws and rods which you use nowadays.
So coming back to my next question, doctor, there are some people who prefer spinal manipulation or chiropractic procedure or Ayurvedic oil massage.
Yeah.
So what's your opinion on that?
So there are many patients who come to us after having undergone any of these procedures. Doing a spinal manipulation or a chiropractic procedure is not safe, because it's a blind procedure. They don't know what they are tackling with, what type of disease they are handling. So it can in fact harm the patient more than doing any benefit. So I would suggest that these practices should be stopped. Okay. And about oil massage, these are just a mild pain relief kind of thing. So they don't actually benefit much from that, because the disease process is not being tackled. The disc herniation is not being managed. The weakness in the muscles is not being managed. Right? So the identification of the problem is the core in the management of spine diseases. So here at Citizens Hospital, what we do a detailed physical examination after taking a detailed history to identify exactly what the problem and where the problem is, as there is in the bones or the ligaments or the muscles or the nerves, and then do a neuroimaging study like MRI to identify and confirm our diagnosis. So once that is done, treatment plan is devised, which includes initial treatment of medications, then physical therapy, and if nothing else works, then surgery will be used as a last resort.
My next question, is laser spine surgery better than traditional surgery?
Yeah, laser spine surgery was a popular mode of treatment earlier, but there are actually no randomized controlled trials to prove that a laser surgery is anywhere better than traditional surgery. In fact, I would say that there are many studies saying that doing a laser spine surgery will have more chances of recurrence of the problem what they are being treated with, and traditional surgery has less chances of recovery.
So my next question is, doctor, there is an apprehension among the patients that they can't play sports or do normal exercises after their neck or back surgery. True?
No, absolutely wrong. Because the purpose of doing the surgery is to get back to your normal lifestyle. Obviously, you need to have a recovery period of few weeks time before you get back to doing some high intense activities. But your daily routine activities will be taken care maybe within few days time. And you can very well go back to doing your sports and doing your regular exercises after a few weeks. In fact, we advise our patients to start these so that they remain fit. So spine health is basically being fit and doing regular exercises to your spine. So that will help in the long term.
My next question is, doctor, do the patient get addicted to the painkillers after surgery?
Usually not, because most of the times nowadays what we do is after spine surgery, the acute pain related to the nerve will be relieved with the surgery itself. And they require painkillers only for the recovery of the immediate surgical pain. That usually are non-opioid painkillers. So those usually don't have any addictive effects. And very rarely we use opioid medications, which are somewhat addictive, but that if they don't take for too long, it won't have any issues.
So the last question for this session will be, Doctor, does a spine surgery make a patient bedridden, paralyzed, and if not, will he be restricted to his lifestyle?
That is the most common misconception among the patients, and I was expecting the question to come a little earlier. So you have kept it for the last, so that's okay. So this is the most common misconception patients have, and it's absolutely false, because the spine surgery is, as I told earlier, as safe as undergoing a surgery for hernia or thyroid. So they will not be bedridden or paralyzed, because nowadays what we do is we do what we call as minimally invasive spine surgery. So where the incision is very small, and he will have a shorter hospital stay, a shorter recovery period, and the patient will be able to get back to his lifestyle, day-to-day regular activities pretty soon. So the chances of becoming a long recovery period and a bedridden state are absolutely nil. Yeah, so the main thing to understand here is that spine surgery is absolutely safe, and it will require a detailed evaluation of the patient and a targeted treatment approach. But as much as the surgery is important, the more important point is that patient has to have a regular post-operative follow-up with the physical rehabilitation therapy, so that he will be maintaining his spinal health. And advanced procedures like minimally invasive spine surgeries will help in a shorter duration of hospital stay and a faster recovery, so that patient can get back to his normal lifestyle quickly.
So thank you, Doctor, for your valuable time and inputs.
Thank you.
So with this, we conclude today's session on Let's Talk Health. We'll be back with another episode next week. Till then, take care, be safe, and thank you for being with us.
Thank you.